Hello, and welcome to Small Business Success Stories at SCORE Houston. This is where we bring insights, experiences, and the journey of successful small business entrepreneurs. SCORE mentors volunteer their time to guide small businesses. SCORE is America's largest network of volunteer business mentors supported by the U.S. Small Business Administration. Here in Houston, we provide free confidential mentoring and education to help entrepreneurs start, grow, and succeed. Now, let's dive into today's small business success story.
Listeners, if you're finding value in this conversation, please take a moment to subscribe on YouTube and follow us on Apple Podcasts or Spotify. It is completely free and takes just one tap. Your subscription helps us bring you new episodes every week with practical insights for Houston's small business community. Welcome to SCORE Houston Podcast. I am your host, PV Bala. Our guest today is Cameron Carter, CEO and co-founder of Rosarium Health. Cameron spent about 10 years inside the healthcare system at companies like DaVita and Bright Health, learning how the money really works and where it gets wasted. And he kept noticing the same thing. People were ending up in the hospital not because they needed more medicine, but because their own homes weren't safe. So he built a company to fix that. Rosarium gets health plans and hospitals to pay for in-home assessments and modifications so older adults and people with disabilities can stay safely in their own homes. It's now in network for more than 1 million Medicaid lives across 30 plus states. Cameron, welcome to the show.
Thank you for having me. I appreciate it. I appreciate being here.
I was quite impressed with what you described your career and the business as value-based care. For our audience, can you describe briefly what is value-based care?
So I'll start with what value-based care is not, and then give that as a juxtaposition to what value-based care is. So the primary way in America that we pay for services in the healthcare space is what's called fee for service. So every time you go to the doctor, you pay a copay or there's an exchange of transaction. What it doesn't account for is the impact of that visit. Did the person get healthier? Do they take their medication better? Or do they get improved? Value-based care actually accounts for that. So it accounts for the experience of the patient beyond an individual encounter. And then more specifically to the actual provider, the provider is taking financial risk for that person. So they're actually financially at risk for the outcomes of that patient. So more advanced, but much more aligned to the patient's experience and the patient satisfaction.
That's good. Now, tell me what was happening in your life at that time when you decided that home itself needed to become part of healthcare.
So around the time of the pandemic, I was already working at a health plan and overseeing what are called supplemental benefits. So these are the non-medical services like dental and vision and telemedicine and transportation. So I was very familiar with the benefits themselves. And one of the things I was always mindful is a lot of times members aren't aware that they have the benefits and never use it. At the exact same time, I had a family experience where family members were experiencing falls in the home. And I remember educating my family on, hey, you might have this covered benefit that will allow you to renovate your home. I'm not covering you. So your health plan that you work with, you talk with them. So I ended up calling those health plans on behalf of some of my family members and realized that, yes, the health plan did recognize the home as an important, critical part of care delivery. They did not have the infrastructure nor an operating partner to deliver that reality. In spite of high cost episodes like falls and readmissions and these other things that my family had been exposed to, the health plan did not have the tools nor the partner to get that work done. And create an idea in me at that point. But I would say what also became clear was right after that, I actually started to renovate my grandmother's home.
Oh,
So with my cousin, we were actually going in there to actually do this work. And once I saw the impact, not only in the lens of improved independence by my family members, but also reduced personal care hours, reduce falls, and more importantly, enabling both of them to stay in the community longer, which was the overall goal that we were trying to solve for with this home modification.
But you already spent good amount of years on healthcare,
Mhm.
on similar value-based care kind of companies. What did you see while working that made you think that you have a business opportunity here?
So when we think about value-based care, fundamentally, it's focused on access to care or removing frictions in the care experience for that person to receive care and receive quality of care. What's unique about that is that does not account for the neighborhood and built environment, which are other social determinants of health that impact not only the care experience, but also total cost of care savings. The ability to deliver a home modification, yes, improves independence, but it also does something that no other benefit can do, which is reduce facility fee payments. So for individuals to not go into a nursing home, to not go into the ER, there's meaningful savings that can occur if you can renovate the home. So my experience in value-based care has primarily always been in clinical services, pharmacological solutions, as well as different types of partnerships. They've never considered, can you remove the most important risk to that individual, which is their inaccessible home? And the reality that if you do that work, you fundamentally unlock an area and a P&L for a health plan that right now no one's been able to solve, which is, can you affect clinical performance and administrative cost savings? That's one thing that we know home modifications can do. Now it's for Rosarium Health to do that kind of work at scale.
Going through your profile, I read that you realized that you were building towards where you assumed the market would be instead of what you actually knew.
And
What tipped you off that something was wrong and you need to also pivot?
one thing one of my investors, Bill Evans at Rock Health Capital, always tells me is that the market doesn't lie. So as you're in a market, it doesn't matter how great your research is, it doesn't matter how good your PowerPoint slides are. People don't want to buy it, they don't want to buy it. And what was clear to us at that time as we were going into more of a direct consumer product in Houston at the time was that people were just not prepared to buy a ramp out of pocket. They were not prepared to use their credit card or debit card to create an accessible bathroom. They were still under the guise that any home renovation should be aesthetically pleasing. It should not account for my health outcomes. It should not account for my health profile. And what was missing in that was these consumers didn't see us as a healthcare company. They saw us as a construction company. By working closely with groups like the Texas Medical Center, working closely with large hospital systems, we were able to pivot that messaging. We were able to pivot our brand. We were able to pivot sort of our solutioning to help the consumer understand what this value proposition is. What it also enabled us to do is understand that it wasn't really on the consumer who needed to be our first customer. It was on the health plan or the state government agency. Both of those two groups are the primary payers for institutional care in America, not the consumer. So as we pivoted from direct consumer to B2B, it also allowed Rosarium Health to really foster its success in what I've been doing previously, which is health plan sales, not direct consumer marketing. So as we pivoted back into what I was exposed to or what I was familiar with, the market really responded well, not only from the adoption of Rosarium Health, but the adoption of Rosarium Health as the operating partner who may not have all the things together, may not have all the sort of like widgets together, but so they're patient with us, which is critical to any early stage company, which is when you get land that first big contract, you want to make sure a contract provider is also patient to say, if you make a mistake, we'll fix this. If you do this, we'll do that. And that's allowed us to really sustain, grow, and evolve to where we are today, managing over 1 million lives or being a network for over 1 million lives in Medicaid.
So you pivoted from selling to the families to Medicare Advantage and Medicaid. So that was relatively easy for you because you had your prior experience was in a similar line. The basic difference, as I see, is you are instead of chasing a market, you are building something that what you already knew, a comfortable zone. Yeah. So
That's correct.
how was it? Difficult, easy to make that pivot from what you're doing?
It wasn't easy to do it because you have to look in the mirror and tell yourself you were wrong. You have to tell yourself that maybe those late nights, early mornings weren't the right use of your time. And that's a very humbling experience. What I would say, what was easy was having the conversation on what we could do with those health plans because we'd done so much work in consumer. So we're already prepared to build the network. We're already prepared to deal with the referral management. We were better prepared to work with these payers just because of the work we had already done in the space. Lastly, what I would say that was kind of a maybe a surprise was the willingness of these health plans to start working with bigger projects sooner. So we're always worried about, will the consumer want to get a $10,000 renovation on our platform, or would it always be these small grab bars? So to see a health plan adopt the product, adopt as an operating partner, and then also want to do bigger projects soon was a great indicator that we're making the right decision to move forward.
I mean, how difficult was that to sell that idea that someone has to pay for not being in the hospital but buying a health plan as a preventive measure for the future? Is a different concept altogether.
It's a difficult concept. It's hard for some health plans to invest in preventional services, regardless if it's home modifications or even a dietary benefit. What was really important to sell was a lot of my experience at DaVita when we talked a lot about what happens if you don't take care of your kidney health and you spike into dialysis, you crash into dialysis. And that resonated a lot because what I would tell them is like there are 5 stages of, pre end stage renal disease that you have access to, and people still miss that. So imagine this, which is you don't even have access to what this person lives in. We provide that for you. You don't even have before photos, before prior authorization, we provide that for you. So it's really helping that health plan understand not only the administrative and the nuanced information that we're providing to them, but is being very transparent of saying, by doing this, you're better prepared to not have this downstream incident that you and I both know is a repeatable incident. People don't crash in dialysis 3 or 4 times, they would pass away. But people go to the ER 3 or 4 times a year. People go to a skilled nurse facility for 3 or 4 weeks. Those costs continue to rise. And then what we made very clear to these health plan partners were 10 years ago, this did not matter to you. I understand that. 10 years from now will be the most important thing to your business. Should you continue to stay in Medicaid? Should you continue to stay in Medicare Advantage? And you have an aging population living in an aging housing stock. Because when you think about the housing stock piece, you take, for instance, in Houston, depending on where you live in the Beltline, your housing stock looks way different, right? You could be in a flood zone. You could be in an area that doesn't even have tree equity. Like all these things matter to what the intervention is going to be in the home. So when we talk to these health plan partners, we let them know you cannot put a ramp in front of everyone's home. That is not a silver bullet. Right. And more importantly, you have some people would say, I don't even want a ramp in front of my house. It needs to be in a garage because that's how I enter my garage. That localization, that personalization is the expectation when you're going to someone's house and you're delivering an intervention like a renovation, not a meal kit, or you're telling someone to get a ride to dialysis. It's if you're going to renovate my bathroom, you still need to be able to do it in a way that I need that's best for me. And that is something that a lot of health plans don't have the brand permission to do, but Rosarium prioritizes that work.
How matured is this concept here in US now? You have many competitors and it's quite well prevailing now in the industry.
So it's a growing industry. I have a lot of it's a tough question, and I'll answer with some data because the data probably gives a better idea of why it's a complex answer. Home modifications as a covered benefit date back to the GI Bill in the 1940s. So when soldiers came back from war and after World War II, the federal government paid to renovate their home as a part of the GI Bill so they can actually get into home ownership. That's how it started. And then from there, Medicaid picked up the home modification benefit 20 or 30 years later as a way to help primarily disabled children to be able to live in their home much longer. What people sometimes don't realize is that the American Disability Act, which the ADA standards to make your home accessible, those did not come into law until 1990. More importantly, those services or those provisions, the ADA Act does not apply to your home. It only applies to public spaces. So
Mhm.
we don't even have a standardization of understanding what an accessible home is in this country. Now we have a definition, but we don't know if it should be 38 inches wide or 40 inches. We don't build homes for accessibility. Now, you ask the question on, is it a niche market? The US residential remodeling market is a $700 billion annual spend market that is primarily driven by people over the age of 55.
Wow, interesting.
They're the ones who own homes. They're the ones who have disposable income. They're the ones who have discretionary funds to renovate their bathroom. Now, are they renovating in an accessible way? We don't measure that. We
Mhm.
don't measure if the stair was an accessible stairway or they just got new stairs. So there's a gap in that research that we hope can be solved through public-private partnerships. We want to be a part of that. But what we do know is that by 2034, 1 in 3 households in America will be headed by somebody over the age of 65, not include, but be headed by somebody 65 years and older. We also know that today, there are less than 5% of homes in America that are accessible. So we realize that there's going to be a tension across
Mhm.
those two realities. And that's why Rosarium Health is being very intentional about today about not only assessing the home for accessibility, but then delivering the modification shortly after to the needs of that person.
Good. That's clarifies the situation. The another interesting thing in your whole business that what I could read was that first thing that you did was getting into venture capital for funding. How did you come to that idea that look, it's better that you get into venture capital? What are the opportunity provided to you that you could go that way?
My experience in working with other startups had exposed me to venture capitalists, had exposed me to the structure of how VC funding works. So I was probably more comfortable than maybe other founders would be to enter into that realm compared to maybe bootstrapping or going after grants or going after other financial vehicles like a bank loan. What it also allowed me to do was take a more risk sooner. And that was really a part of why I thought venture capital was the important route to go. And I say it because there was so much uncertainty on the policy side of Medicaid and Medicare Advantage that by the stroke of a pen, a state like Texas may all of a sudden not be the state you should be working in anymore. Right. Or all of a sudden there's a great opportunity in Connecticut and you just want to be able to go into Connecticut. So venture capital allows you to take a lot more risk in that regard. And now that we've raised a little over $9 million between our rounds, it's allowed us to really take on those risks to know what to do, what not to do a lot sooner in a market, and also what to do sooner in a market on go to market strategy. So VC's been helpful, but it also puts you under a shot clock. You got to be able to have a big business very soon. And not a lot of folks are familiar with, okay, you have 7 years to grow into $100 million company. Go. Like, and that's the expectation when it comes to venture capital.
And just for the purpose of educating our listeners
Hmm.
okay, on venture capital, there are queries now more often from our clients that they would like to pursue this path. So, can you explain, like, for example, in your case, how did you assess what is the total capital required? And what was it that you could get from the investors as a seed capital? And when you pitch to the investors, what are they looking for? And how you could convince them that this is a business worth investing in?
Well, it was hard. I would say when you're positioning a business in the venture capital space, you have to make the investor or investors feel very comfortable that this can be it's in a large market that somehow is untapped, that you as a founder know how to go, attack and enter those markets. But that's hard. What I would say, kind of going back to the VC comment, I spoke to a lot of VCs that said no. So that's just an order of the situation. It feels very similar to academia. If someone's ever been in academia and they're writing R15 or R01 or R03 grants, you're going to probably get maybe 5 to 8% of those grants ever funded. So it's a numbers game. So I would say on the VC side, it was ensuring that I wasn't just talking to healthcare investors. I was talking to construction company investors. I was talking to consumer investors and really expanding my reach to build that bench of capital investors. And then lastly, when you're asking what are they looking for, it depends on the stage. So if you're looking for a pre-seed investor, they have standards on the revenue, they have expectations on the team size. If you're looking for a seed round like what we just raised, revenue becomes much more important, right? You need to be able to have a clear milestone, have to get to over $500,000 in revenue, but you have to have a clear pathway to get to 2.5, 3 million in revenue. Because when you get to a Series A, the expectation is that you already have it surpassed $3 million in revenue. So
But what was
businesses,
your initial pitch? What did you ask for, and how did you justify that?
so what we're looking at, so we ended up raising $1.7 million. And the justification for that was to really hire a team to build the consumer product and then to drive marketing dollars to really drive demand into our market. The justification was based on a financial model that we feel confident behind. It was based on us only going into a couple of cities, so we weren't over leveraging the business. And then third, a lot of market research on the needs of a city like Houston, Texas, and a city like Phoenix, Arizona, which are already aging, and the aging in place needs are very clear, but there wasn't a brand that was operating at scale to deliver these services.
So you went with a total pitch of 1.7 million. And
Mhm.
what did they expect from you in terms of equity that you need to put in?
So on the pre-seed side, it depends. I mean, they can sell 10 to 33% of their business at that stage. It's not uncommon. It used to be 40%. We were in the 20s, which is pretty average, nothing special. But the outcome of that investment was that we would sign at least one health plan contract in the next 2 years.
Mm.
We would enter into at least 2 states, and we had some network numbers, so like how many people would be in our network. Those are some other benchmarks that we're
Yeah.
marching toward in the funding.
Mm. And later, after the first pitch and first money that went back to them, right, for the second,
Some reinvested, yeah, back in the business.
what
Some
had changed
others,
by then for you in terms of business?
meaningful increase in revenue, more partnerships. We were delivering services now in 3 different states, not just one state. Hiring needs had evolved as well.
And since then, you have moved to bank financing also now?
We were still with venture capital and then reusing our profits from the business into the business. So we haven't really used bank financing or venture debt or things like that nature.
I read that you have moved further to 30 states and network of clinicians and contractors. So how do you manage? How do you run the business, keeping quality consistent, and so much happens beyond what you can supervise?
Well, it starts with who we bring into our network. So we have a really strong policy and procedure arm of the business. So before we do a lot of credentialing, a lot of interviews to see who's actually going to even be in our network more than anything. And that normally helps to keep the right type of provider in our network.
Mhm.
Additionally, what we do a lot of is a lot of touch points, a lot of customer interviews. We really stay close to also state associations
Mhm.
when you think about being engaged. So really working with local associations to really
Mhm.
support their message and their businesses at scale.
You being located in Houston with Texas Medical Center and Houston being a healthcare hub, this would have mattered a lot for your growth, right? Is the right location for you
That's correct.
compared to being located in any other state. I mean, yeah.
I think it's true. I mean, we were in the Texas Medical Center Accelerator 3 years
Yeah.
ago. And I said it then. I said now I think Houston's one of the best cities in the world to grow a healthcare business in. Beyond it being a large city, a diverse city, a welcoming city, I think it offers an incredible wealth of talent. And we're excited to build in Houston.
Very good. Going to another track, talking about mentoring, you talk about your high school track coach, Pendleton, as a good mentor. And then I think the score you had some amount of mentoring from Art O'Connor. How mentoring has shaped your career, your life, and how it has helped in your business?
What mentoring has done for me in my life is create probably the first and most consistent safe space for me to be a vulnerable person in, whether that's discussing failures in sports, discussing uncertainties in my business, discussing things I'm not aware of, but also receiving feedback in a welcoming environment. That's not always available to a lot of men in this country. So mentorship allows that opportunity for me. And I've had it, like to your point earlier, with Coach Pendleton in high school, and even Art Connor and SCORE provided that when I didn't even know how to do an LLC, or what the difference between a C Corp and an S Corp is, or when am I supposed to file my taxes. These things can make people really uncomfortable at even starting a business because, you can't always chat GPT some of these things. So having a mentor to, put their arm around your shoulder and tell you when to zig instead of when to zag, it's meaningful. And then how it shows up today is, I'm not necessarily a big mentor to a lot of people, but I try to be a helpful resource when I can be, utilizing some of the attributes I've learned from my mentors in the past to help that person in that moment.
So, how do you envisage the next 5 years for Rosarium?
Honestly, I think we can become, not the first, but another $1 billion exit in the Houston
Wonderful.
area.
Excellent.
To me, I think, Rosarium could be one of the many alumni of the Texas Medical Center Accelerator that has, a 10-figure exit. That's not I don't know, a DME company or a service company. It's like something much different. I think the other side to it is that I think we can be a model for companies that you can build a mission-driven business in a niche area, and if you follow the right, parameters and keep your nose clean, you can still create a beautiful thing. And that's something that at Rosarium, I don't shy away from it. It's like we service the older adult and frail and elderly population. Like, it's not, we don't service the 1%. We don't service the word well. We service people who a lot of times have been forgotten about. And to build a big business there comes from a certain type of mindset. I get that. But I think a lot of entrepreneurs want to get back to blue collar innovation. They want to
Yeah.
get back to like rolling their sleeves up and doing things and being builders. And, this is not a knock to all the different food delivery companies, but I think it's one where a lot of founders want to get back to building meaningful things for people.
Wonderful.
And I want Rosarium Health to be an example of that over the next 5 years and beyond.
Great. And I think in that direction you move, you will be offering an IPO also.
From your mouth to God's ears, I hope that can happen. That'd be great to be a great representation for the many people across Houston of what that can look like.
Beautiful. Thanks, Cameron. Wonderful talking to you. And thanks for coming over to the podcast.
Thank you so much for your time as well. Appreciate it.
Before we wrap up, a quick favor. If you find this podcast valuable, please hit subscribe on YouTube and follow us on Apple Podcasts or Spotify. It is free, takes just a second, and helps us continue bringing you weekly episodes designed to support your business journey.
Thank you for listening to Small Business Success Stories at SCORE Houston. If you are an entrepreneur or small business owner, we'd love to support your journey. You can reach us at 713-487-6565 or visit us at 8701 South Gessner, Suite 1200, Houston, Texas, 77074. Our office is open Monday through Friday, 10 a.m. to 2 p.m., except for federal holidays, and walk-ins are always welcome. To learn more, request free mentoring, or register for our workshops, visit us online at www.score.org/Houston. Until next time, keep learning, keep growing, and remember, at SCORE, we're here to help you thrive.